Hi, I'm Joe Garma, and this video is for anyone who needs to figure out the underlying cause of their health issue. Many of us suffer with hard-to-explain conditions like fibromyalgia, chronic fatigue syndrome, hormone imbalances, or other health problems that may be caused or be made worse by some autoimmune disorder. I write extensively about health and fitness and try to be a good example of someone who is healthy and in good shape, but I discovered that I have a problem. On the surface, I appear very healthy. What I found out, though, was I have some issues such as high fasting blood sugar, chronic inflammation, a poorly functioning thyroid, and high LDL. That's the bad form of cholesterol. And given my healthy habits, this was very surprising and confusing. I decided to do some research and found out that there's some underlying cause that's instigating these issues. What I found out is that it all could be due to mercury toxicity. Now, everybody has a certain mercury burden that his or her body has to deal with. The question is the mercury in you making you sick? There are two parts to this video. Both will rely on my interview with Chris Turf of Quicksilver Scientific. Chris is a mercury expert among other things, and Quicksilver has created the best mercury test you can get. In part one, Chris and I will discuss in our Skype interview where mercury comes from, how we get it in us, the damage it does, and how we might purge ourselves of it. In part two, we'll review my Quicksilver Mercury Tri-Test results. We'll find out if I was right that mercury might be the insidious culprit behind my troublesome health issues, and what specifically can be done to get healthy again. We're very fortunate to have Chris Turf take the time to teach us about mercury, his company, and the Quicksilver Tri-Test. So Chris, thanks for taking the time to be with us. Tell us a little bit about yourself and Dr. Shade, who invented the Quicksilver Tri-Test.
So Dr. Shade created Quicksilver about 10 years ago, and originally he was a PhD chemist studying environmental mercury, and he began a process of understanding how to differentiate between the two major sources of mercury that are out there. There is organic, which is typically coming from fish and seafood, and then there's inorganic, which typically comes from environment, dental work, vaccination, decomposition of mercury products. And so he was testing for mercury contamination in the environment, but perceived that there was probably a good chance to use those same testing procedures in humans and understand what those two types of mercury, how we were exposed to them, what the exposure levels meant as far as, whether you were toxic or not, and then where those species went in the body. They both act quite differently. The methyl mercury is very mobile. It moves around. The inorganic mercury likes to sit still, sequester itself in tissues and that. So perceiving that, he started testing people. And that's been, I think, about 7 years ago. And he came up with a pretty novel process that utilizes blood, hair, and urine. No one else out there does that at this moment, where they look at those three samples from the body and are able to speciate or tell us what sort of mercury we're getting exposed to and what the levels are.
Right, so let me interject. So if you're a fish eater, for instance, you're getting one type of mercury, and if you live near a coal plant or near a highway, you're getting another type of mercury.
Absolutely, yeah. Yes. And they act quite differently in the body as far as toxicity and mobility.
Mm-hmm. And would you say that for some people they might have a certain mercury burden or certain load, but it is not impinging on their health, but for somebody else it might be seriously impinging on their health?
That's very true, and we see that very commonly. People ask us all the time, am I mercury toxic? And usually we can tell after talking to someone for about 10 minutes whether they are or are not, and it's significant to understand that it rarely has to do really with overall numbers. It has often to do with the patient's other health issues going on.
So in 10 minutes you're asking them questions about their health conditions. You get a sense from what they're saying about themselves where they have an autoimmune issue. Is that right? That mercury might be behind it?
Yeah, and it is interesting. I get tests that come in and have very, very high levels, and this person doesn't really seem to be symptomatic that they're aware of. And conversely, I see tests come in that have what we consider to be fairly low levels, and the person's very toxic. They're having significant health issues. and from that low amount of burden that they do have.
And that might be because of, I've read some of your work, there's this term called detoxification pathways. Is that a fair way to describe it?
Yes.
Which means how good does somebody eliminate the burden that that's getting in them through ingesting fish or other types of foods or inhaling mercury from the atmosphere?
Definitely. So your detox ability plays a big role. Your background health conditions play a large role, and interestingly enough, epigenetics play a large role as to whether you're keeping mercury in the cells where it's quite toxic, or if you're able to move it out to your blood and then through your elimination systems.
Right. So there's, I think from what I've been reading from your site and others, is that, would you say that there's two basic pathways for elimination, and one that winds up being excreted via urine, and the other that winds up being through the kidneys, and one through the liver, bile, colon, and then out, that way through, through defecation, correct?
Yeah, that's true. Interestingly enough, also your skin is a detoxification pathway. Skin's the largest organ in your body,
right.
And we do know that mercury is secreted through the pores in the skin.
So that would make it three major ways that mercury gets out, would you say?
Yeah.
Yeah. Okay. Very cool. You mentioned that Dr. Shade created the test. You're a pharmacist and herbalist, correct?
Yeah.
So that gives you an interesting angle on all this, especially from like a herbalist perspective, given that you've experienced how herbs and natural interventions help people improve their health.
Yeah, definitely. Botanical products, a lot of them are able to increase your elimination ability through your drainage systems, the kidney and the liver. And as a background, as a pharmacist, I'm a compounding pharmacist, so I make things. And I had a lot of patients that would come to me, and I had a real difficult time with certain ones of them balancing their hormones. And I was, I'd been doing it for quite some time and had a lot of success, but I would have these kind of patients that I called outliers, where I couldn't understand how come I can't quite home in on this. And it was men and women. And a woman came to me at some point, and she was one of my kind of more difficult patients to get balanced. And she had taken a heavy metals test, and her metals were off the chart. So I started to think about that, and wondered, is there a role? Is there a correlation here? And as we went along, I had other people take heavy metals testing for if they were having, difficulty with balance of hormones. And overwhelmingly, what I found out was that those patients had metals issues, and it made their immune function funny, and it made balancing hormones difficult. And so when I met Chris Shade, I already had I had formed an opinion about this, and then augmented information with what he taught me, which was a huge amount of information, and found myself then becoming a part of a company that really is kind of forward thinking about how we understand exposure to metals and how to test for them and get rid of them.
Mm-hmm. Well, that's a good segue for me, Chris, because I want to share my hypothesis about my own situation with you. Readers of my blog know that I was shocked to find out that I have some health issues to grapple with. Despite the fact that I write about health and I try to present myself as being someone who is in really excellent shape, I found out from some blood tests that I took that measure such things that some of the metrics, the biometrics that give indications of overall health, for me, were pretty poor. I had high homocysteine levels, my testosterone was low, I had high fasting blood sugar results, chronic inflammation, and I was shocked to find out all these things because on the surface I looked quite hale. So I was perplexed about how all this could be, and it occurred to me when I thought about it that I have 2 cracked molars in my teeth, and my teeth are filled with amalgams. And I just kind of wondered if the mercury from those amalgams were leaching into my body. So I did a lot of research about mercury, and I found that that might be the issue. And I developed this hypothesis, this idea, that the underlying cause behind my poor biometrics as a result of the tests I took could be that I have a mercury toxicity problem. So what I did is I called Rich Carson, the founder of Pro Health, about it, and he told me about the Tri-Test. He told me that he recently took the test and that I should do the same thing. Well, and as you know, I did, and you have the results, which I'd like to get into soon. First, I'd like an idea about what the common issues are that people who go take this Tri-Test, those common issues that they have, the issues that drive them to take the test, the things they want to find out. I know you have a glutathione-based supplements that help clear up the detoxification pathways that are often compromised and blocked by people who have mercury and heavy metal toxicities. So can you tell me about these?
What brings people to us more often than not is that they have some sort of functional, disability. They can't balance their hormones, or they have autoimmune problems. They have unexplained health issues, we'll say. And it is often that they've gone to physicians or practitioners that really can't dial into what's going on with them. And often it's kind of almost a last resort. They've come to us to test for metals because they heard that, that's a possibility causing some of their symptoms. And sure enough, oftentimes when they test, we do find that they have maybe not only retention of metals, but a functional disability to excrete them properly so that they are accumulating.
Right, right. So there's this interesting idea that, when you talk about aging, I write a lot about what aging is, and I guess there's so many theories about it in the details of it, but basically it's deterioration, right? This thing called time happens, you accumulate debris, you accumulate issues in the body at various levels of the body, and things rust out, just like an old car in the rain or in salt water. It rusts out, and if you don't do a hell of a lot of maintenance, some people are going to age faster than others, or feel the deterioration faster than others. Well, if you're accumulating toxins like mercury over time, that can very much accelerate what else is happening over time, declines in hormones over time, such as human growth hormone, which declines precipitously in your 20s, and then your blood sugar winds up increasing even for normal people as you get older. Testosterone in men declines as you get older. All these things are happening, but they're probably also happening in a faster rate as toxicity increases and affects that. I was very surprised to learn, for instance, that mercury can be behind a low testosterone for men.
Yes, absolutely. And certainly, you're right. As we age, our detox systems become less adept at, getting rid of toxins. The glutathione system is not as robust. Once you reach 30, it starts somewhat of a decline. But you're absolutely right. When you add a bunch of mercury onto the top of it and it ties up your glutathione system, it makes it even less effective. And I do believe that metals have an effect in accelerated aging, as you mentioned.
Yes. Okay, let's dig more into glutathione. Glutathione is an extremely important antioxidant that our bodies naturally produce, but can also be taken as a supplement. I know a lot of the products that Quicksilver has are glutathione based, as well as that you have other supplements, and they bind to mercury and other heavy metals, and they help excrete it from the body. Could you explain this further, as well as talk a little bit about the protocol that you suggest people follow?
Sure. So in a nutshell, when we get down to nuts and bolts as far as a detox process, Quicksilver has applied some scientific knowledge to mercury removal that's a little bit different than what some other people are doing out there. People often hear about chelation for detox of mercury and other metals. Chelation certainly has a place, although it has to be used very correctly. Otherwise, we can cause more problems than it relieves. To that end, Quicksilver perceived that if you boost the ability of the glutathione system to do its job properly, and also use a binder in the gut that binds mercury and other metals, that we can exact a lot of change. We can show significant declines in mercury levels of both species, and also the patient's ability to excrete mercury is enhanced. And there is a correlation also of increase in positive feelings, or symptoms basically abate or decrease.
Okay, what does Quicksilver offer in terms of supplementation?
What typically we're going to have you do is use what's called the Detox Cube. It's a box looks about like that. I'm looking on the cameras.
Yeah, no, we see it.
And that has 4 products in it and a protocol. The protocol is simply laid out so that you can understand what supplements you should be taking when. It's laid out, morning, noon, night, lunchtime, and it tells you exactly which supplements in the kit to take when. And the kit basically contains 4 different supplements, 3 of which address the glutathione, and then the last is a binder that works in the intestine. It's a small powder. It's basically a thiolated silica powder. It's not absorbed into the bloodstream at all. It only acts in the GI tract. It takes a very small dose. In fact, I don't know if you can see this, but there is a scoop.
Yeah, I can see that.
Lid, and that scoop is quite small. It's a 20th of a teaspoon, and that's what you dose the IMD with. So, and then the 3 products that are addressing the glutathione system are liposomal glutathione. So it's glutathione that's put into a liposome. And a liposome is a small particle that is phosphatidylcholine. It's a lipid. It's a type of fat. It's very well absorbed through tissues in the mouth and the upper GI tract. Glutathione does not have good absorption orally typically. It's destroyed by the stomach and the enzymes in the stomach. And so it's not efficient to take just a glutathione capsule, say. Mm-hmm. So within that liposome, you get good absorption into the bloodstream. So it's addressing your deficiency of glutathione. Then we have a product called vitamin C with our lipoic acid. And the vitamin C, of course, great antioxidant. Our lipoic acid helps to address Nrf2 systems. It helps to augment the glutathione's ability to move mercury out of intracellular space, whether it's in the organs or wherever, into the blood, because that's the first step. You have to move it into the blood so that it can be removed from the blood by your body's drainage system. And then there is also a product in here called Clearway Cofactors. It actually is the only encapsulated product that we use. It's a phytonutritional product. It has a lot of herbal type nutrients in there, Haritaki, again addressing the Nrf2 system and a lot of the enzymatic systems. The antioxidant ability helps to boost glutathione's ability to do its job, because you're enhancing its enzymatic systems as well.
Now you referenced Nrf2 system twice. How would you define that?
Nrf2 is a master antioxidant switch, and it happens oftentimes during aging and also during infections or heavy metals exposure that Nrf2 gets downregulated or shut off. If you don't have Nrf2 systems working, your antioxidant system is not working well, and it shuts off a lot of your detox channels. Mm-hmm. So it happens commonly that patients come to us and they're just, their systems are downregulated enough that they're really going to have a tough time going ahead and detoxing metals because of that systems.
And that can happen no matter who you are, where you are in life. But particularly, I'm imagining it's exacerbated in people who have chronic fatigue syndrome issues, or fibromyalgia, or any autoimmune issue, or already are compromised with some kind of chronic health condition. All the way down to me. You'll tell me in a minute if you think the Nrf2 pathways are an issue for me, but here I am, as hale as can be on the outside, and yet I might be having some of these issues myself. So I think it's kind of important to get a handle on this.
Sure.
Yeah, and so go ahead.
It is interesting because sometimes it's a chicken and egg thing. People have autoimmune dysfunction and heavy metals, issues, and it's tough to tell which came first. People ask me all the time, well, is mercury causative for this particular disease state? Oh, yeah. In many of these cases, we're uncertain about that, but we do know beyond a shadow of a doubt that metals levels will play havoc in the background. They're always bad background actors. So whichever came first, it almost doesn't matter. You need to address both issues.
Right. Now that box you showed us, was that the pre-tox?
No, this is actually the detox part of our detox protocol.
Okay.
We do have pre-detox protocols, and it is common that we perceive that patients who have functional disabilities within the GI tract or with the kidneys or the liver, your basic drainage systems, we want to address those prior to using this detox protocol that I just showed you. And the rationale there is, again, the mercury or the metals are in the blood, but if the blood is not draining well through the kidneys, the liver, the GI tract, the lymph is not working properly, it almost doesn't matter what sort of supplements you throw at it as far as, you know, a detox protocol. If everything's stuck at the kidney level or the GI tract, you're not going to be doing much. So we do have pre-detox protocols as well.
Okay. All right, generally speaking, how long does it take for the average person you test to get rid of, to reduce their mercury to acceptable levels, given the use of your protocol and products?
Yeah, and as you probably can appreciate, some people have much more burden than other people do. But I would say on average, if they go through our detox protocol, 5 months is typically a marker for people that have moderate levels of mercury, and people with higher levels, it may be as much as a year and then kind of maintenance after that.
Okay, that's a wrap for part 1. Remember that we all have the ability to get rid of mercury and other heavy metals, but our detoxification systems can get overloaded and compromised. What we need is a procedure and specific supplements to boost our glutathione detoxification pathways. Now go check out part 2, where Chris will dig into my Quicksilver Mercury Tri-Test results and suggest a protocol for me to follow to clear my toxic mercury load. You'll see in intimate detail exactly what the Tri-Test measures and learn why it's the best, most comprehensive mercury test available. And one more thing, links to products and more information are below this video. If you want to follow along as I rid myself of my mercury toxicity, there's also a link to subscribe to my email feed.